Good morning, everyone. This is Elizabeth Claus of the International Low-Grade Glioma Registry. I'm joined by Research Associate Matthew Crick, and we are very excited to introduce our guest today, Dr. Christina Weyer Jamora. As mentioned on her slide here, she is the Division Director of Neuropsychology and Behavioral Sciences and a professor in the UCSF, or University of California, San Francisco Department of Neurosurgery. And I will say that the International Low-Grade Glioma Registry has had the benefit of working with Dr. Weyer Jamora as well as her colleagues, and they have been hugely supportive of the registry. So Dr. Weyer Jamora is an expert, as you might note from her slide, in neuropsychology, but also in returning to work after a diagnosis of glioma. Focused on lower grade glioma, but working with all grades of glioma, and recently won an award at our national organization, the Society for Neuro-Oncology, for this work. So we are thrilled to have her talk to you today about some of the tips that she can offer and counseling regarding this topic. Dr. Weyer Jamora?
So wonderful to be here. Thank you so much, Dr. Claus. I really appreciate it, Matthew, for putting this talk together and asking me to come. And I'm really excited to talk with you today about what we're learning whenever it comes to returning to work after glioma. So thank you for that. So returning to work after glioma is something that my patients and I have been working on over almost a decade now. And so one of the highlights of my work really is this topic area. And I'm really excited to talk today about what we're learning. And while we have a lot more work to do, I'm really excited to be able to kind of offer some of the insights that what our data says is helpful to consider in returning to work after glioma, and also share some patient stories. So I'm excited to do that today. So I don't have any disclosures. So what are we going to do today? So what I want to share is what we know about returning to work after glioma from a research perspective, including one of our own studies, one of the studies that Dr. Claus had highlighted that we recently shared at the Society of Neuro-Oncology conference. Also discuss some challenges and ways to address them when thinking about return to work. Helpful resources to consider in your return to work journey, and maybe even talk a little bit, if we have a good amount of time, about one of the folks that I worked with who had a glioma and returned to work as a nurse. And then of course, additional resources as well. So what do we know? So many individuals with glioma want and can return back to work. In most recent estimates, return to work for lower grade glioma hovers around 62%, but return to work rates vary depending on tumor type and a lot of other factors and molecular characteristics, as well as comorbid or other medical problems that people have. So, and also for many of the folks that I work with, patients talked with me about that returning to work kind of represents returning back to their normal life, and in many ways kind of represents a very important success for them, that they've reached a point where they can begin contributing again to their work life, as well as financially to their family. And oftentimes financial pressures are real for many of the folks that I work with, and not going back to work, even if financial part isn't something that is affecting your reason to go back to work, it can affect your quality of life in terms of mood and all of the rest. So when we looked at our data, what we saw is that there are some there's a particular part of our population that is really interested, glioma population is really interested in returning back to work, but needs some help with that. And so we have, in our return to work study, we have a particular protocol that we use. And in our trial, we saw about 82% of individuals, after they went through this particular type of cognitive rehabilitation, had improved work status. And that meant either returning to work because they were completely not working at the time, or that they had maybe been on a performance improvement plan, or were struggling at work and were getting some negative feedback at work from their boss, and had some improvement in their work status where they were able to get off those performance improvement plans. So, and this is compared to about 34% of the non-treatment group, people that did not go through this particular treatment. So, and it didn't matter if you were working or not at the time when you started the intervention, but that you could improve. And we also saw that there were some factors that gave us some or kind of shed highlight in terms of who was it that could respond to kind of this return to work intervention. So, so individuals who had higher radiotherapy dose had a harder time with improving their work status, which makes sense because we know that higher dose radiotherapy can negatively impact, especially the white matter tracts of the brain, which can lead to some cognitive changes. Also, those with, if you had some depression and didn't have access or didn't engage in some of the kind of standard of care treatment, psychotherapy or medication for that, then that made it a lot harder to be able to return to work. So taking care of your mood was really important too. We saw other things. So if you had better verbal memory, better thinking speed, better executive functioning, if you had IDH mutation, which kind of suggests that the cancer was slower moving. And also if you were really motivated for treatment, that was also really important when you thought about returning to work. But it didn't necessarily matter if you were working at the time or if you were older. And so age and work status was not. So what we saw that it's complicated to return to work, and it takes a team, and it takes working with your providers, sometimes with some additional medical workup or work simulations. Like I would have people come in and they would practice aspects of their essential job duties in session with me. And then we would give feedback and develop a system to be able to address any gaps, that, for example, if they were having a hard time managing their email, that we would put together kind of an email kind of management system, and then they would pilot that before they return to work. Also workplace accommodations, being able to work remotely, being able to kind of have frequent breaks, and those sorts of accommodations were really important too for folks. And of course, we want to make sure that we're thinking about this, knowing that not everybody has access to these sorts of resources. We want to think a little bit more about how we can help you kind of learn some of those important pieces that we learned in our clinical trial. So let's talk a little bit about that. So some of the barriers that my patients talk about whenever they're thinking about returning to work is that they're having a hard time learning things. Or maybe it takes longer, it takes twice as long to complete half as much. So their thinking speed is slower, their stamina, they have a hard time with being able to kind of sit and do things at work as they had before. And they somewhat kind of feel surprised by that. Like, well, I thought I could kind of go back, and I didn't realize how tiring it was going to be. Difficulty multitasking is also, having a hard time with sitting down and doing something, for example, at your computer, you're writing an email, and then someone comes in your office and, they say, oh, I need this. And then you answer that person's question, and you can't remember where you were in what you were doing and that you were writing that email. Difficulty finding words or tracking conversations. And these are all sorts of, these are also found in the literature. In terms of the factors consistently associated with glioma and cognitive changes. So having a hard time with being able to pay attention flexibly and being able to use your work skills in an effective way. And also sometimes if your medical condition isn't stable, if you're having some seizures or you're having some other symptoms, that also can make it challenging, to be able to go to work and be able to attend medical appointments as well as work. And accommodations are also another piece, which I'll talk a little bit more about in a little bit. So why does why is cognition negatively impacted in brain tumor, in glioma? So even before surgery, a lot of the folks that I work with say, I started to notice some changes even before the surgery. And, they didn't really, some of them got a little bit better after surgery, but not all of them. And it's also really common that throughout someone's course, they'll have some changes in mood and behavior and thinking, and that some of that it can be due to the tumor treatment itself. Some of it can be due to some of the medication effects that are, that you need to take to be able to continue to manage some of the seizures and swelling. Sometimes it's also fatigue, that you do okay in terms of most things, but then when you get tired, you have this big symptom flare of word finding problems or muddled thinking. And that insomnia and substance use and emotional distress and stress in and of itself can also kind of magnify some of these cognitive symptoms. So when we think about return to work, whenever I talk with folks, I always think about it in 3 pillars. So when someone says, Dr. Jamora, I want to return to work, how do you think about it? So after, kind of doing this work for some time, and looking in the literature, some of the ways that we think about it is 3 buckets. Your knowledge and skills, for example, your understanding of the job, your cognitive skills, your ability to kind of actually physically do aspects of the work, from a physical perspective. And can you keep up with the pace and nature? And that has to do with fatigue and stamina and being able to kind of deal with they call it environmental load, or the complexity of everything that's being thrown at you. And then also, can you manage the stress and pressure? So some work environments are a pressure cooker and there's a lot of politics, or there's a lot of challenges in terms of team dynamics. And can you manage that in a way that's meaningful, but also allows you to be able to get the work done without having kind of symptoms of depression, anxiety, panic, and all of the rest. So let's talk first about knowledge and skills. What does that look like? So when we think about improving knowledge and skills for work, there's a few things that we usually are thinking about. For some folks, they decide, what, I didn't really like my job whenever I was in it before. And I think I want to do something new. I was thinking about doing something new anyway. So going through some vocational counseling or job retraining can be really helpful. And in some states, they actually they'll help you do that. I know, for example, in California, there's the Department of Vocational Rehab that actually can help people with job retraining and talking with your provider, if that's something that's locally available for you, could be helpful. Also, by getting a more detailed cognitive assessment and emotional assessment of how you're doing, especially as it relates to some of these skills for work, you can learn a lot about how, what are your skills, what are your strengths, how can you leverage those strengths to be able to ultimately offset some challenges you're having at work. That also can be really helpful in talking with your provider about that. And then also some folks do go through rehabilitation of a lot of different types. It might be physical rehabilitation if you're having some physical difficulties, or speech therapy, or cognitive rehabilitation is kind of more what I do. It's a little more general in terms of general cognition, but more specific to work. Also, job accommodation. So, for example, a lot of the folks that I work with, they need accommodations to be able to do their work. And we'll talk a little bit about that in a minute. But some common accommodations that patients will have is, again, working, maybe we're having a graduated schedule where they start off working fewer hours and then they slowly build their work schedule as they're able to tolerate more and more and more, to be able to kind of get them, they call it habituated, or get them used to kind of going in the workplace and being able to manage all this cognitive activity, which, sometimes it can be a warm-up period to do that. Also, the other thing that we see again and again and in the literature is simulated practice. Is For example, I have this one guy right now that we're working together, and he does a lot of PowerPoint or slide deck presentations for a living. And so he's in a role where that's 50% of his job. So a lot of the rehab is him doing, kind of going and doing and putting together these presentations, and actually being able to go and giving him feedback, and giving him some compensatory strategies or workarounds when he's having word finding problems or having a hard time with being able to keep on track with what he's saying. And then, of course, organization, pre-planning to reduce that pressure. And we'll talk a little bit about what that is. So initially, kind of what I think about is we want to manage the fatigue and overwhelm. We want to get you sleeping as much as we possibly can. Healthy sleep is, sleep isn't good. A lot of things aren't good. We also want you to develop and implement systems to help you get things done, whether that be assigned places or designated places for your keys or your wallet or your purse, getting your backpack ready the night before, double checking and having like a system for when you put things in your calendar, in your email management. All of that will really help, especially when we're thinking about managing the multiple balls in the air that we have at work. And being present during tasks, we know that our that attention and concentration can be really a bugaboo for being able to getting things done. And so being able to cultivate this present mindedness and also attentional control, or being able to stay focused on a task without rabbit holing into something else or getting distracted, and building that into your day. And also being able to learn from both successes and challenges. And so not shying away from, gosh, I really messed that up. And what did I learn there? Okay, well, I learned that if I don't kind of work my system, and I don't kind of take a picture of my car, for example, when I go to work in the parking garage, I'm going to forget where it is, and then I'm not going to be able to remember where it is. Or I need to have a cord at my office for my laptop, and I need to have one at home, because if I don't have that, then I might get to my office and not have a laptop cord, and that could be a problem. And also considering feedback from others. Sometimes there are people in your lives that really have your best intention. They have best intentions, and have their they really want you to succeed, and being able to consider feedback from them, soliciting feedback can be really helpful. So let's dive in a little bit deeper. So whenever we're thinking about fatigue and stamina, and some of this is from the NCI or National Cancer Institute guidelines, we want to encourage people to talk with their primary care provider about a workup for fatigue. Maybe there's some other things going on that are negatively impacting your energy. And also wanting to make sure that they're taking a look at your medications and simplifying regimes as much as possible, and taking a look at it, and you're letting them know that you're having some side effects, and are there any things that can be done there. But sleep, I think, is probably the major thing that I see the most for patients, that they're having a hard time, where, they maybe don't have a winding down routine before they go to bed. Or maybe they lay in bed awake for, hours and hours, and that's not good for promoting sleep. Or maybe there's their daytime napping, and having a hard time breaking that habit, and that's negatively impacting their nighttime sleep. So again, I think that working on some sleep, and in the later slides, you'll see there's some patient education that you'll have access to that kind of goes into much more detail. But I think I would say that either working with your providers, or being able to access some good sleep, promoting good sleep is really, really helpful. And also we want you to encourage managing stress. So stress definitely has an impact on people's fatigue and stamina. So integrating some healthy lifestyle as you can, yoga, massage, healthy eating, some physical movement. Physical movement is particularly helpful for addressing fatigue, even cognitive fatigue and stamina. So optimizing that can really be helpful. And one of the things that some of the folks that I work with, they'll talk about, and they do this at work as well, is that they'll feel really rushed to kind of get a lot of things done, and they'll kind of tell themselves, I just need to, I know I'm tired, but I just need to get this done and I'll feel better. And then they have some increased fatigue because they kind of overdo it, and then they end up with these symptom flares, word finding problems. Their brain fog really gets the best of them. Maybe they start to feel kind of sick to their stomach and unwell. And then they need much more rest to be able to kind of reconstitute or feel better. And then there's some guilt around that, and then that leads to overdoing. So preventing overdoing, and really being able to kind of pace yourself is important. Some of the patients that I work with will talk about that, I wish I hadn't just went back to work full time at first. I wish I would have had a little bit of a gradual ramp up, and definitely want to recommend doing that. And sometimes even before people go to work, we'll encourage them to do some volunteer work. So they're just getting used to going somewhere for 3 or 4 hours, kind of doing some task and then kind of going home. You're getting in the mode of that. Also trying to do more taxing tasks whenever you're fresh. So for example, for me, it's really tiring when I'm looking at spreadsheets. And so I have to look at those in the morning, and I can't do spreadsheet time in the afternoon. And having a fatigue plan. So this is our fatigue stoplight, the red, yellow, green. So we encourage people to think about, so green is when you feel good, that you're really, kind of humming along. And yellow is maybe whenever you're starting to maybe have some you're starting to have some more word finding problems. You're thinking, it's harder to think clearly, it's muddled, you're kind of missing things. And red is when you're kind of maybe even having you're having a hard time getting words out. You're really not tracking what's going on in the conversation. Your thinking becomes very slow. So what we want to do is kind of take a prevention approach where we kind of prevent ourselves from getting into the red 90% of the time, tracking what your factors, what's yellow like for you and what's red like for you, and then catching it when you're in yellow, kind of taking your foot off the gas a little bit, kind of taking, we call it a brain break, where maybe it's just, I need 5 minutes to just shut my eyes and put on my noise canceling headphones and not process any information. Or maybe it's that I need to not talk, or I need to have a no talk break. Because again, my language centers are a little tired, and I need a little pacing. For some folks, they need some visual rest. So they'll look out the window, and kind of, or go take a walk, around the block to be able to kind of get some different activity. Not the same mode of cognitive activity. All of those can really be helpful, but tracking those triggers, and helping to intervene early before it gets to red will be helpful. So one of the things that we see again and again is this sense of overstimulation. So whenever there's too much, and we see this, in traumatic brain injury, we see this in stroke, we see this, also as people get older, or even younger kids, that there's this kind of sensitivity to overstimulation. And so a lot of what can help with also fatigue management is reducing light and noise. So for example, having noise canceling headphones. If you go into a really busy work site, that can be really helpful. That was really helpful for this one individual who would oftentimes go on construction sites. Having a daily routine, so that way you have certain things on certain days. So for example, my laundry is always on Sundays. And I also have like certain days of the week that I do certain tasks, and that can really help with my daily routine, and giving myself extra time. So if I think it's going to take me an hour to get something done, I usually give an extra 30 minutes buffer, so that way I'm not racing. Sometimes I do have to limit people, places, and things, and that's something that some of my patients will do. Is sometimes they opt out of that big social party because they're just feeling like they're on the red, and they're kind of redlined and they're already tapped out, and going to one more thing would just really set them back. Regulating that sleep-wake cycle, like we talked about. and really trying to pace yourself to whenever you're trying to get things trying to get things done. So these are some of the particular skills. So I usually poll my patients and ask them, so of all the things we talked about, what are the highlights? What are the top, what's your top 10? And this is what they talk about. So one of my patients said, have a system and work your system. So they had an email system that they would flag an email whenever they've looked at it, but haven't read it, and it still needs to be addressed. And they would just, consistently do that every single time. Or they would, whenever they agreed to meet at some particular time, they would put that in the calendar. Even if it wasn't confirmed, they would put it as tentative, so that way they wouldn't give that time away to somebody else. But they would have to stop and implement their system and do their system every time before they moved on to the next task. Also using placeholders when you take rest breaks. So for example, if you're working on something, but you're tired, kind of highlighting where you ended at a document in terms of where you need to go next, or jotting down a couple of notes of what you still need to do on that document. That can be really helpful to be able to reorient yourself when you go back to what that task is. So that way you kind of, or it's easier to pick up where you left off. Using reminders and alarms, I think that's a pretty common one that my patients oftentimes talk about, is that they really do need to have some reminders and alarms to tell them to go to various places, to to check on the stove, to be able to get ready for that meeting or get ready for that presentation they're going to do. All of that is really helpful, and trying to have a system where you say, okay, pretty much if it's this type of task, I need only 10 minutes of a reminder in advance. But if it is like a big, say it's a big project, I might need that reminder 2 weeks in advance, so that way it's on my radar before it comes and feel ready. One of my patients talked about whenever they're overwhelmed, it's really important and helpful for them to break it down into smaller pieces. So they have this big project due, and so like, okay, well, let me just take one small piece of it. Let me start with, who do I need to ask to be on my team to do this? I can't think about all the other things. I just need to do that. And then breaking it down little by little into smaller tasks, and then tracking those over time. One of my patients talked about how important it is for her to rehearse and script out what she wants to say. She had a lot of difficulties with word finding problems and being able to speak, especially whenever she had to speak in a meeting. So she would oftentimes rehearse more like the technical parts of what she was going to say. And she found that to be really helpful. She also found that doing that over Zoom was more kind of lent itself better to scripting than others. And she said that was really helpful. And also pre-planning and prepare in advance. So for example, getting your backpack ready the night before. If you can leave a meeting a few minutes early to get your notes and kind of get yourself settled in terms of what your to-dos were, and also prep for the next meeting. So leaving enough time, buffer time in between things, that can be really helpful. And also talking aloud the steps of a task to help keep you on track. So for example, if you're trying to remember a string of numbers, sometimes saying them out loud a couple of times as you're say you're going from one spreadsheet to another, or one document to another, that can kind of help to optimize your attention and concentration. And these are some other things. So creating a to-do list prioritized by urgency. So does it need to be done? There was a study that talked about if you kind of would prioritize by how urgent it needs to be done, rather than all of things in a laundry list that wasn't anchored by urgency, that you'll be more likely to get it done more quickly. Of course, we talked about calendars with reminders and developing routines, and using placeholders, of course, when you take rest breaks. So what about technology? So this is some of the technology that my patients love using. So they love, so if they have to produce a letter, or if they have to do a long email, that would be tiring to them. So a lot of my patients use ChatGPT for that. And sometimes that is part of the work that I'm doing with them is kind of refining their understanding of prompts and how to do that. The paper to-do list or electronic to-do list sorted by urgency of needing to be done. That also similarly can go into Google Keep. A lot of my patients really like that. Otter, a couple of my patients, I found that Otter is really helpful. So it's a voice to text, but it's integrated. It can be integrated into a lot of different platforms. It can help you kind of more accurately dictate an email. It can help take notes for you. So you're not having to, in a meeting, you're not having to take notes, as well as be able to listen at the same time. It also can switch between different voices. So you can, so it'll know like who's talking at what time. It's a really kind of interesting platform. At least 2 or 3 of my patients have said that they really like using Otter for voice to text whenever they have, especially visual issues. They're better, but they're better kind of listening than they are like listening and writing, which I think was great. So what is it like to do cog rehab? So I thought we would talk a little bit about a case today for those that are interested in what does that look like. So this is Mary. So she was diagnosed with a left frontal grade 2 oligodendroglioma, and at the time she was working at a full time as a surgical nurse and had recently given birth. And after her surgery, she was able to work full time. She was able to return to work full time on her own. Later on, she had a progression. She had her brain tumor needed surgery again, and so again she was able to return back to work after surgery and some chemotherapy. But the third time that her brain tumor came back, she noticed difficulties with bouncing back like she'd had before. So her family noted that she was having a hard time mixing up steps when cooking. Before she did that, no problem at all. She would have gaps in judgment, such as walking into traffic hazards, and she had difficulty answering multi-part questions. She could answer like one-step questions, but she wouldn't be able to really answer like if you asked her a series of questions like 2 or 3. So physically she was doing fine, but she was really struggling, and she was worried about going back to work as a nurse and being safe to be able to contribute to her patients' lives. And it was really hard for her because she really wanted to go back to work, but was worried about her ability to do so. So her typical day was making IV kits. She would review patients' charts. She would also verify the location of the procedure where they were going to do the surgery, give medications, and receive verbal assignments from the charge nurse. She was also, her job expected her to be able to remember detailed patient information, give report, and quickly make decisions about patient care, of which she kind of acknowledged that would be really a struggle for her. So this is what her neuropsych testing found. And so the red line is, so to be able to read this, the red line in the middle, that's about where you want to be. You don't want to be down in the -2 range, because that meant that she was having some pretty significant difficulties, as she was reporting, with doing tasks in sequence and forgetting steps when she was doing things. And it was even worse whenever she had to go quickly between 2 different sets of information. So if she was cooking and then somebody asked her a question, she had a hard time kind of navigating between those 2 things. She would forget what she was doing while she was cooking, or she wouldn't hear the other person. So and so this was problematic because the role as a nurse required that she do tasks in a particular order and more than one thing at a time. But her judgment for hypothetical safety situations was excellent. So she was a great nurse. So she remembered kind of what to do, but implementing that intention made it hard, and she got distracted easy. So what did we do? So we did a lot of helping her. Her fatigue, she got fatigued very easily. So one was helping her to kind of do better with being able to manage her fatigue and being able to kind of increase her can increase her stamina through physical exercise, through being able to kind of have doing practice doing work in a kind of a quiet place. She would bring in these she would bring in these kind of structured assessments that she would have to do, and we practice. I was her mock patient. She would practice doing these structured assessments over and over and over again. Thankfully, she had an aspect of her job that was repetitive, and that she could kind of just go. She could do like the pre-operative assessments, where she would call a patient and just would go through a structured assessment. And that was a really helpful thing that we did in cog rehab, where we would practice that over and over again and give her practice at that, and also teaching her ways to not to improve her distractibility, or helping her to keep on focus more through the use of mindfulness, and then also some strategies such as the NBAC computerized retraining, which I think was really helpful. She did end up also having a lot of it needs some help with managing anxiety. So we talked a lot about ways that she can sometimes it was about focusing on her emotions and doing some meditation and kind of the soothing activities. She also found exercise to be very soothing, and kind of talking to herself in a kind way to reduce that anxiety. But sometimes also it was also problems focused. So she would start to get anxious about all she had to do. Sometimes that meant that she needed to kind of organize herself a little bit better. Or maybe she was needing to establish some healthy boundaries about what she could and couldn't do as she was building her stamina and working on managing that time pressure. So what happened? Well, she was able to improve through giving her some strategies to be able to that were tailored to her unique strengths. Through the use of kind of managing her mood and managing her anxiety. So she was able to manage the stress and the pressure. She was able to manage the pace and the nature of kind of doing a task for 4 to 5 hours and kind of working up to that and doing those workplace simulations. She was able to improve her attention and concentration, or verbal learning, executive functioning. So her thinking speed still was a little bit slower. And so we continued to help with giving her strategies to work around her slow thinking, doing more pre-planning, again, kind of doing the structured nursing assessment, which I think was really helpful. Today, her tumor still remains stable, and she is working with positive support from her employer. She also had somebody go with her as she was going back to work. And that in terms of, she had a more senior nurse to shadow her, and they call it re-precepting or reteaching and signing her off. And, through that, her systems that she used, the hospital, her unit ended up adopting a lot of the strategies that she used, because they were just good organizational practices that benefited other people, which made her feel really proud that she could help others. So what are some other things, in just the last few minutes that we have until we get to questions, what else should folks be thinking about when they go back to work? Well, one of the things in the United States that we think about is the Americans with Disabilities Act. So your employer, so to access the ADA, your employer has to be big enough. So it isn't, not every employer must be ADA compliant, but what it is that it helps to protect folks from discrimination due to their medical condition, and it also can give access to reasonable accommodations and be helpful for reducing folks' vulnerability to being laid off or fired due to some of their performance due to a medical issue. So sometimes some of my patients kind of have some nervousness about submitting letters asking for ADA accommodations or to protect their employment. And oftentimes it is a very individual, decision in terms of that. And talking with your employer and talking with your manager can be, anxiety provoking, but it is important to know that that there are job protections for individuals with medical issues. And a lot of patients that I've worked with have successfully argued for accommodations. So what are some accommodations that are typical? So, so maybe you need to kind of shift your schedule a little bit because you tend to be a little bit better in the morning than the evening. So sometimes people will shift their schedule in the morning instead of the afternoon. Or maybe you need a different workstation that is, maybe your workstation is in the hub of everything, and you need something a little bit quieter because of all the like the auditory noise and all that. Then maybe that can be an accommodation. Or maybe asking for special equipment. So anti-glare screen, if you are having a hard time with the kind of the visual sensitivity of looking at screens for a long period of time, or maybe you need double screens because that you can blow images up that's easier to read. More frequent rest breaks or working remotely. And we also talk about trying to kind of non-essential tasks. So for example, special projects, maybe whenever you're first going back to work, maybe that's not the time to take on a special project. So asking for non-essential job duties to be kind of, they call it redistributed or given to somebody else until you're kind of back feeling ready to take that on. Those are some examples of some accommodations that folks have. So communication is really important whenever you're thinking about going back to work. So, so having some conversation with your manager or even with your manager in HR about that you're slowly getting back to work, that you want to kind of gradually kind of ramp up in your in your responsibilities, and that you want to take it slow, and that sometimes having one-on-ones, frequent one-on-ones with your boss can help you to prioritize like what part of the job is most important that you expect for me to get done. And what other things can I deprioritize? So working with your manager as a kind of a team-based approach that can be really helpful, and being able to set some boundaries for yourself in terms of, gosh, it's 4 o'clock and I'm feeling really pooped out. I think I need to kind of take a break. So that next hour, I'm going to try to do what I can, but I really need to take a break. And for example, not having a lot of meetings in the afternoon if you know that if it's within your control and you can keep from that. So there's oftentimes my patients and I will talk about after going back to work and being out for some time, being able to answer some questions that other people have. Sometimes people are curious. Sometimes people are wanting to, they don't know how to talk with folks who've had brain cancer, or they may not know that why you were out, but there can be all sorts of questions that come. And this is one of the this is something that one of my patients have talked about, is the swivel. Is they'll acknowledge what someone else says, like, oh, my uncle has cancer, and not necessarily going into detail about their own. A patient wouldn't go into detail about their own medical issues, because it's not required that you tell your coworkers that you had the nature of your medical issues. And so she would say something like, oh, I'm sorry to hear that. That must have been hard. And what did you think about that meeting they had yesterday? So swiveling back to something that's a little bit more neutral, a little bit more about work. And it's similarly like, how are you feeling? Well, I'm really excited to be back. And in fact, I have a few questions about that new time card system they put in between now and whenever I was last here. Do you have a minute to answer them? So just being able to be acknowledging that people, sometimes they don't know how to, they don't know how to support you, and don't know how to talk with folks as they're going back to work, but you being able to kind of swivel to something that's a little bit more neutral to be able to manage that. So these are some other things that may also help. So the Job Accommodation Network is a great website because it has all of these kind of different examples of workplace accommodation. So that's a place that I think can be really helpful when you're thinking about like, well, what kind of accommodations do I want to ask for? What's fair game? So that's another place I think is really good. Cancer and Careers is a great website. It has a lot more detailed information, for example, about the Americans with Disabilities Act, some resume building and other kind of resources, specifically as it relates to return to work. So I think that's really helpful. Thinking about if you wanted to do something different, or if you wanted to kind of get a more formal rehabilitation, thinking about vocational rehabilitation or even occupational therapy. Now, and knowing that not everybody can return to work, and and that's okay for a lot of folks, and so sometimes they do need to consider, for example, disability, federal disability, or even if they have private disability insurance. So thinking about those pieces, and I know that a lot of the patients that I've worked with have found, for example, employment advocates or Social Security disability attorneys to be helpful, especially in the kind of appeals process, and working with local centers that do that work can be really important to get you the resources that you need. The Living Well with Brain Cancer Cognitive Strategies is a manual that we put together with our patients to be able to help kind of highlight again and kind of more deepen people's self-help around using and learning some strategies to manage some of these thinking changes. And so really, it was just a joy to work with folks to put this together. So really recommend taking a look at it. It has sections on fatigue and sleep and managing distractibility and memory strategies. It has a lot of great information in there. I use it every week, and it's really, I find it incredibly helpful. So it's free use, and there's a QR code if you wanted to click into it. And then and that is all. And I'm really excited to hear questions and other ways that I can support you and kind of share what my patients have taught me over the time.
Thank you so much. That was fabulous. So we do have a couple of questions, and I know my patients ask this as well, but kind of the day-to-day reality, if you're not at a place like Brigham and Women's and UCSF, how do people find resources locally? Who do you go to ask for these sources?
So a lot of people will start with their primary care doctor. So they'll start asking questions with their primary care doctor about, do you have other patients that are having a hard time going to work, and what would you recommend? So sometimes if they think that they need a more detailed medical workup, that, oh gosh, that fatigue, that doesn't sound quite right. Let me make sure that so I think that's one resource. Sometimes people also will ask to work with occupational therapy, because that's their bread and butter to help people get back to work. So I feel like that is a resource that is often more widely available than some of these more specialized services. And then I think that also people check out the Cancer and Careers website. That's another place that people get ideas about where they can advocate, and then also talking with their manager about what they how they can start returning back and what they can do.
So another question, what are your top tips for poor sleep and stress? I know that's a
I
broad
love
question, but very, very important.
And I have to say, I too can get stressed and not have great sleep. So I'm with you. So I think the main thing is figuring out, is it something with your sleep-wake cycle, like you're having a hard time, like you're having a hard time with like going to sleep, staying asleep, and why is that? So and then sometimes it's also like sleep apnea. Sometimes people have undiagnosed sleep apnea and they need to kind of get a workup for that. And then some people, I think the main thing that I really see is, one, having a sleep routine, and also having a sleep routine when you can't sleep in the middle of the night to go back to sleep. So sometimes people have a sleep routine to go to sleep, but then to stay asleep, that's where it kind of falls down a little bit. So they'll stay in bed awake for long periods of time. So you don't want to stay in bed awake for more than 20 minutes. Get up, do something kind of boring. If you have something on your mind, try kind of journaling it out or writing it out, and then try to go back to sleep. Take a warm shower, anything to kind of relax yourself and reset. The other thing that I think people can try is to try to do a little bit of visualization meditation. So if they're really feeling kind of anxious and up in their head, thinking and thinking and thinking, they can try to distract themselves onto something else. And meditation, it can be not for everybody, but it definitely can be really helpful for folks as they're trying to kind of calm their mind a little bit. And then I guess the other thing is no late napping and no late caffeine. So, and good exercise. So those three things I think really also help. So getting some good exercise on a routine basis can help you sleep a lot better. And trying to, sometimes people will also drink alcohol or they'll use marijuana to get to sleep. Unfortunately, that doesn't make your sleep quality really good. It can get you to sleep, but then your sleep quality isn't great and you can feel kind of like not so great the next day. So trying to manage that as much as you can. And then if all, and I guess, and then if all else fails, try and talk with your doctor. A lot of the patients that I've worked with, they've tried things like over-the-counter sleep medicines, and it just made them feel more foggy. So I am trying to avoid some of those over-the-counter medications like Benadryl and things like that can make you have more brain fog. So, so trying to we have some many more tips in the QR code COG strategies manual. So check out that and, do a little bit of a checkup with like, okay, well, I'm doing this, but I'm not doing this thing over here. I'm napping until 5 in the afternoon. So maybe I need to kind of throttle back on that. So start small and work it from there.
So we have a few other questions, but I'll just pick one, and we will ask our guests to respond to your other questions after the webinar ends. But does health insurance tend to cover occupational therapy?
It does. It does cover occupational therapy if you have a physician referral. So a physician would say, yes, it's medically necessary. And by and large, it is a very standard part of most insurance plans. I can't say it's all, but it's very standard part of insurance plans. Definitely, if you have Medicare, it's definitely insurable.
Okay, well, I will end there. I know there's other questions, but we will ask Dr. Weyer Jamora to answer them after the webinar ends. Thank you so much, everybody, for joining us. And thank you, Dr. Weyer Jamora. It was fabulous. I learned a lot, and I know that people will benefit very much from your knowledge. We did put some resources, and they'll be available on the website as well.
Great. Thank you so much. It was an honor.